Welcome back to our ABC of conditions. Today I want to talk about B for backs. I'm not going to cover the whole of the topic of back pain because I could be here for months. What I would like to do though is to talk about, in my book, the most common misconception, and that is that most back pain is caused through muscle strains and sprains. So let's look at this issue of the muscles. This is obviously skeleton. You've got the pelvis bones here, the sacrum and the spine above. Now if I add the first layer of muscles, so which one is it? Which one does one manage to strain or sprain? Add another layer. Could it be one of these? It can't be anything great, otherwise you'd see bruising. Let me add another layer. There's another layer of great big muscles in here that are designed to keep you upright and stop you falling over. They work against gravity. So there's another layer, and yet another layer, and you can see how they're great big straps from those very tiny ones that we saw first, right the way up to this, to that, and to that. Now, can you explain to me how a little bit of a muscle can be strained very simply, say walking down the street, even slightly bending over, when you've got this great mass of muscle tissue in there designed specifically to hold you upright against gravity? It is not possible. It is not the muscles that are causing the problem, it's the joints. 1, 2, or all 3 sets of joints. And treatment proves the point. What's really going on to cause your back pain is problem with these joints, and there are 3 sets of them. The first ones that everybody seems to know about is the discs in here. They sit between the bones of the spine. You have the sciatic nerve that comes out of these places here and out of these holes here, and that forms sciatic nerve, which will give you pain down the leg. What you also have, these joints on either side here called facet joints, and they are stabilizers for the spine. If you didn't have them, then the bones would literally fall off each other. So they sit on either side as stabilizers. Underneath that, you have the joints called the sacro-ilyac joints, which sit between the 2 bones of the pelvis and this bone here, which is the sacrum. The coccyx is way down at the bottom, and that's your residual tail. So you can have a combination of facet joint, sacro-ilyac joint, and even discs. That's not common, but it can happen. What we see most commonly are problems with the sacro-ilyac joint here. Now, as you can see from this rather elderly spine, the sacrum sits as the platform for the spine above. Now, if these joints get jammed on one side or another, and there's up to 35 different ways that they can get disrupted, they can get jammed in all sorts of different ways and means, then you're going to affect the spine above. And that changes the loading through the spine, through these facet joints, and through the discs themselves. So the thought is that if you have problems with the sacro-ilyac joints, that is going to set a scene for problems and altered loading and damage to the discs themselves. Let's think about how this can happen. The standard way of damaging or jamming up the sacro-ilyac joints is a simple slip or a slide or a fall. Now, we do that all day long. We can slip on the ice, we can stagger about, we not quite get in the right place, and it will jam up one of those joints. Under normal circumstances, we would be squatting. We wouldn't be sitting on chairs. And that is what we're designed to do as human beings. It's the fact that we sit on chairs that keeps this situation going. Squatting opens these joints and is nature's way of self-correcting. So if you don't squat, and I mean fully squat on the floor, as you see in Africa, Asia, China, all of these countries, they will squat out of habit, and they will do it from very small to the very old. And that is nature's way of self-correcting these problems that we get here. You can get problems with the facet joint because the sacrum is wrong. You can get problems, as I say, with the discs because the sacrum is wrong. So everything in our book comes back to these joints. And we can teach you how to correct it, how to manage it, how to stop it happening again. But it needs a detailed examination and treatment to do that. Thank you for watching. I hope you found that useful. If you'd like some more information, then please visit our website. There's a lot more information we put on there, or you could always leave a comment or send us an email. Next video will be C for carpal tunnel syndrome.